Welcome to DHEC's March 3rd media briefing on COVID-19. I'm Christy Moore, Chief Communications Officer, and I'll be facilitating today's briefing with Dr. Linda Bell, our State Epidemiologist, and Nick Davidson, our Senior Deputy for Public Health. Dr. Bell will provide an update followed by questions. Before we begin, I'd like to remind everyone to please remain on mute so we get a good quality recording. Dr. Bell, I'm going to turn it over to you now for today's update.
Thank you, Christy. And good afternoon, everyone. Yesterday, South Carolina announced that because of the significant increase in the vaccine supply and in our progress in vaccinating those in phase 1A, meaning frontline healthcare workers and those aged 65 and over, we're now ready to move to the next phase of our vaccination plan. And so beginning Monday, March the 8th, those eligible to receive the COVID-19 vaccines as part of phase 1B can begin scheduling appointments. And these groups include people who are 55 years of age and up, those among us who are at increased risk for severe illness should they be infected with COVID-19, and then frontline workers who have an increased occupational risk, which are people who must be in person at work and perform a job that puts them at increased risk of exposure due to their frequent and close, that means less than 6 feet, and ongoing contact of more than 15 minutes with others in the work environment, either their co-workers or the general public. And some selected examples of these include school staff and daycare workers, manufacturing workers, grocery store workers, law enforcement, and this includes others as well. Individuals who are at increased risk in settings where people are living and working in close contact are included, and then all workers in healthcare settings in the community or in a healthcare facility who have routine direct patient contact and who are not vaccinated in phase 1A. And for specific details about these various groups, you can go to the DHEC website at scdhec.gov for more details. Our state's vaccination plan prioritizes those with greatest risk while also assuring equal access to the vaccine for every South Carolinian aged 16 years of age and older. And one of the biggest questions that we've received so far is how people will show that they're eligible to receive the vaccine in phase 1B. So we've been using the term self-attestation, and our formal 1B guidance states that individuals can attest to meeting the criteria. And we understand that that term self-attestation may be confusing. And so we, in making this decision, looked at many other states, and some states like New York and Massachusetts and Louisiana and others have actually come up with a self-attestation form that someone must fill out to demonstrate that they're eligible to receive the vaccine. And while we considered that, as well as other options for including vaccine eligibility in South Carolina, it was ultimately decided that to keep the vaccination process as simple as possible and with as few barriers as possible for residents and providers, we opted on what we've come up with. So in essence, we are asking South Carolinians to just be honest, to consult with their employer or their healthcare provider about whether they meet the current vaccine eligibility if they're not sure, and to realize how important it is not to jump the line, because it's jumping the line that takes the vaccine doses away that could truly be life-saving for someone who may be at higher risk. So just as for nearly a year now, we've been asking people to wear a mask to protect others as well as themselves, it's very similar to that in caring for and understanding for other people's needs, we're asking South Carolinians to continue into phase 1B with the vaccine distribution to make an honest assessment of whether or not they're eligible to receive the vaccine. And it's important to know that people with certain conditions are much more likely to die or to become hospitalized from COVID-19 than are healthier individuals. And DHEC's #1 goal has and continues to be to prevent any additional deaths. And we hope that that's everyone else's goal as well. And we prevent deaths by making sure that the right people, based on their risk, can get their vaccines first. As we continue to make great strides in our state's vaccine rollout, I do want to again thank our hundreds and hundreds of vaccine providers who are working very hard to get our vaccine doses into arms as safely and as quickly as possible. And initially, we had only 131 vaccine providers activated around the state, whereas today we have 482 activated providers, and we also have 685 enrolled providers who are waiting to be activated to receive doses to administer as soon as the supply is available to provide doses to them. And on another note, I would like to draw attention to the newest version of our vaccine demographics that was launched today during our 1 p.m. website update. And so, as we've mentioned before, when this is a new resource that first went live, the vaccine dashboard will grow as more information becomes available, and we will continue to expand it regularly. And it will be updated regularly as we work to provide a big picture to look at COVID-19 vaccines in South Carolina. I'll mention some of the key enhancements of the dashboard, and one of them is what we call a resident-centric look at vaccine administration. So while the first version of the dashboard focused on where the shots were given based on the provider giving them, the dashboard will now focus on where the people live who are actually getting the vaccines, a completely different picture showing us how we can assess vaccine accessibility. There is a metric for indicating how much of the state's total population have received their first and second doses based on the vaccine type. And this will help us see how close we are to reaching herd immunity. And that is estimated to be about 70 to 80% of the state's total population having been vaccinated. And more refined data on reporting, while our vaccine allocations webpage really mirrors the information that was reported by providers directly into the federal Tiberius and VAMS systems, our dashboard presents the data from our own state database called SIMON. This is our immunization registry. So Tiberius and VAMS are federal databases that funnel information into our database, SIMON. But because SIMON is our own database, and we're able to provide cleaner data by using the SIMON data. So we are aware of some duplicated information that's being reported into the two federal systems. And our SIMON system is able to identify duplication and provide what we believe will be the most current and accurate vaccine information for our state. Our plan is for the information on our vaccine allocations webpage to be fully represented within our dashboard, and for the dashboard to be the sole source of accurate and current vaccine information for our state. And with that update, I'm now happy to take questions. Thank you.
Thank you, Dr. Bell. And the first question is actually for Nick Davidson. Can you help clarify how someone knows if they're eligible for Phase 1B, and if they are, how do they in turn prove to a provider that they're eligible to get their shot?
Sure, thanks. For those that are or who are eligible for 1B, certainly that information is listed on our website. We've put up what I believe is a concise, great guidance for people to be able to use. It's at the scdhec.gov/vax, V-A-X, facts, F-A-C-T-S, vaxfacts. And if you scroll down just a bit, you'll see 1B, 1C, and 2 phase guidance. So that's available for people. Certainly any individuals who may not have website access, or it's just easier to make a phone call, they can call our vaccine information line, 866-365-8110. And if they're eligible, and you know, you've heard Dr. Bell say a bit of this already, but if they're eligible by age, they can show their driver's license or another ID. If they're eligible for any other reason, we're simply asking South Carolinians to be honest and not jump the line.
Thank you, Nick. The next question is also for you. Local hospitals and providers are saying they would not be requiring proof of any medical conditions or employment, and would rather err on the side of providing a vaccine than vetting everyone seeking one. How can the state make sure Phase 1B guidelines are followed?
Sure, the hospitals certainly, or providers in general, certainly have some good points there. It could be very difficult, very challenging to do that, at least challenging to apply that universally and successfully. So we're urging providers to vaccinate people clearly according to the phases in order to prevent severe illness and death. As we've said all along, providers should use their best judgment and not make the process more cumbersome or complicated on themselves or their patients. This should be easy. Getting a vaccine in South Carolina should be easy. We're also urging people to get vaccinated when it's their time for their phase. Vaccine certainly is becoming more available, but to require proof, for instance, of high-risk medical conditions, if you think about it, would really mean that everybody would essentially have to make a doctor's appointment and prior to coming for a vaccine. And so that is not only not right, it's not practical. It would further, frankly, disenfranchise members of our community who may not have easy access to be able to do so. So individuals will need to answer questions online or potentially verbally if they're just presenting to a provider. We want to make it easy for them, for those who are eligible. And we believe that the vast majority of people will be honest. This is consistent, as Dr. Bell said, with what most, frankly, of our neighboring states either are or will be doing in the near future.
And do hospitals face any risk if they vaccinate people not identified in Phase 1B? And does it matter if people seeking a vaccine say they qualify, even if they don't?
Sure. We really do believe that all of our providers want to vaccinate, and they've told us so according to the state's vaccination plan, according to the guidance that we've put out. As long as a provider isn't willingly vaccinating outside of Phase 1B, then there's really no risk to them. Again, we're asking people to be honest about which phase they're in, and quite frankly, it's that simple.
And Nick, why was the shift done now when there are hospital systems like Roper St. Francis saying they don't have enough vaccines for Phase 1A?
Yeah, so there certainly has been some increase in vaccine supply and in vaccinating people in Group 1A thus far. We've heard reports here and there from around the state, not everywhere, that indicate that vaccine appointments have not been filling. So this was the time to be able to do this, and it doesn't mean that it's perfect timing for everyone, because that's just not possible. But when we hear that demand in many places seems to be waning, we want to get shots in arms as quickly and safely as possible, and so this was the time to do that.
Okay, thanks, Nick. Dr. Bell, I've got a question for you. This reporter says, since yesterday's announcement, I've gotten complaints from seniors whose canceled appointments have yet to be rescheduled. And they're furious the state is moving on when they still can't get a shot. They say they've tried to find a new appointment and can't. Are there any suggestions for these seniors? And secondly, is DHEC advising providers to give those seniors priority when supplies catch up?
Well, yes, we certainly understand the frustrations that people experienced with the limitations in supply from some of the weather conditions, for example. But we're encouraging people to, when possible, go back to the original provider and try and reschedule another appointment. If they have difficulty doing that, they can use our vaccine finder on the website. And if they don't have access to the website, they can actually call the number. I'll say the number that they can call to get assistance with making an appointment. And that is 1-866-365-8110. And an operator will be able to assist individuals with finding a location for that's convenient for making an appointment. And we are asking providers not to give priority to others before they have vaccinated those whose appointments were delayed, making sure as best possible that they can reach those in Phase 1A first, because there was good reason for them to be prioritized based on the higher risk. And we're also encouraging providers not to use first dose vaccines that are available to give second dose vaccines for others. And those are the main points.
Thank you. Nick, I've got another set of questions for you. The first one is, in light of South Carolina moving into phase 1B, with current providers receiving an increased supply of vaccine, or is it more likely that DHEC will increase the number of providers across the state to meet the additional demand?
Current providers are going to continue to receive vaccine, and we hope to continue to increase the shipments that we send to them. However, we also want to increase the number of providers across the state because we need to get closer to where everybody is. We need to get closer to our residents to be able to provide them vaccine quickly and easily. So we already have hundreds of locations who are now receiving vaccine. I'm very excited to say that we're bringing on an additional 120, I think 124 is the number, independent pharmacies this week. They provide great coverage around the state to some very rural communities and also additional coverage in our urban areas. And we also have hundreds of more providers who we are waiting to activate once we have more vaccine. So we're trying to increase the amount going to providers. We're trying to spread the number of providers such that we have a greater geographical coverage, as we know we have a lot more people who need vaccines.
So as DHEC has expanded providers, have allocations to hospitals gone down by a percentage across the board, or does it vary by region? And then thirdly, is that why hospitals have needed to cancel appointments?
No, expanding to new providers has not decreased the allocations to others. Certainly, I know that providers have been very aggressively scheduling appointments, and that's great. We want to try to get to as many people as quickly as possible. And I can only imagine, they've done that in hopes that what facilities, what providers, what hospitals ask for from us is what they will get. But their requests greatly outpace the amount of supply that we have. That's been true for some period of time now. Their allocations have begun to go up some as the vaccines have gone up some, but at this point in time, vaccine supply is the largest challenge that we have in the state.
And so what guidance did DHEC give providers ahead of yesterday's announcement in terms of making appointments for 1B folks? I have heard from several 1B readers who were able shortly after the press event to go ahead and make appointments, while others complained they couldn't sign up yet. Are providers supposed to wait until Monday to allow 1B folks to sign up for an appointment? And did DHEC need to issue guidance after the press event to make them do that?
Right. I know that when instances like this occur where we have a press event around a movement of our progress to new phases, that generates a lot of excitement. We did put out guidance. We didn't certainly want to lead the press event because we didn't want to get out in front of the governor and our director with that information. But immediately following that event, we put out guidance on the website that we had prepared and that we were ready to go out with. And that guidance indicates that individuals should be able to make appointments starting Monday for vaccinations Monday and beyond. So we wanted to ensure that we allowed providers a few days for some advanced planning to update their website, to make those modifications, to update their phone operators and get those messages consistent with our messaging and our guidance. But that won't start until Monday. The Darlington event, that mass event that was going on, had not filled quickly enough. And so we thought it was not filling quickly enough. And so we thought it was important so that there weren't doses that went unused and were wasted, and an awful lot of effort putting together a very large event so that didn't all go to waste. We did allow them to, we made an exception and allowed them to begin to schedule 1B. It just made sense to be able to do that because ultimately we want to get vaccine in people's arms as quickly as possible. But for all those scheduled appointments that we have out there and for the future scheduling that we'll do, we do want to try to give those who haven't had a chance to have a vaccine from 1A yet a few more days to be able to do that. And so I know there can be confusion about why do we wait, but we want to make sure that we are giving everybody the greatest chance possible to get their vaccine within their current phase.
Okay, Nick, got a few questions here about the vaccine supply. So is DHEC anticipating an increase in vaccine supply in the coming weeks? And if so, how much of an increase? And lastly, how will phase 1B work if there is such a limited amount of vaccine coming into the state each week?
Sure. During most weeks, we've seen what I would call an incremental increase. Sometimes it's been in Moderna, sometimes it's been in Pfizer. I wouldn't say we've seen massive increases at any one particular time, but each time that we are told about our week's allocations coming up, we've received at least that. And so we've been pleasantly surprised each week that we tend to get just a little bit more than we had been planning for the week prior, when we usually typically get notified about what's coming for the next week. Moving to 1B makes sense now because of what I said earlier. To some extent, we have so many more providers that we've been able to onboard. In the past couple weeks, we've onboarded over a couple hundred pharmacy locations around the state, so particularly Walgreens, Walmart, and CVS. And so this has significantly expanded the vaccine reach that we had. And that's a great thing. And when we begin to hear information about vaccine appointments not filling fast enough, we began to fairly routinely hear that, actually, not everywhere, but in many places. The increase in vaccine providers, the incremental increase in doses just makes it make sense to be moving to 1B at this point in time.
Thank you, Nick. Dr. Bell, I've got a set of questions for you. The first one is, Dr. Simmer asked people yesterday not to jump the line in front of the more vulnerable, but the estimated numbers for the combined 1A and 1B categories mean very few adults will remain ineligible after Monday. Is he referring to people who qualify for a shot under the broad 1B categories, but should hold off until more seniors have time to get one? According to census estimates, there are only 4.04 million adults in South Carolina, and the combined estimates for people eligible in phase 1A and phase 1B is just under 4 million. Considering some 16 and 17-year-olds qualify in phase 1B, that can't leave too many adults for phase 1C and beyond. If you have numbers, I don't, for people remaining in future phases, please share.
Yes, well, I mean, certainly with broadening it to phase 1B and with phase 1A, we are now reaching a very large proportion of the population. But we do only have estimates of the population for those phases. So for example, there will be people who may meet the criteria in both phases. So they would not necessarily be deduplicated if a person has eligibility in phase 1A. They could also be included in our population count estimated for phase 1B. So we could be double counting some people in both of those phases, and a deduplicated or only counting them once in one particular phase would give a better reflection of who's eligible in a specific phase. And then further, we have firmer numbers for some categories than others. So for example, the population of people who are age 50 and older, we have a pretty firm number for that. But for including something like women who are pregnant, that can change from time to time, and we don't have as firm a number. But we did work with state agencies to get the best population estimates that we could in moving into phase 1B. So again, these are just estimates, but we are now allowing eligibility for a very large proportion of the entire adult population who is now eligible to be vaccinated, who are, of course, 50 years of age and up, and those who have underlying conditions regardless of their age.
Could you please provide some examples of a person who may fall under developmental or severe risk disability category, because that definition is so broad? And then how will people know if they fit, and could they be turned away?
Well, some of the information that we used to determine their risk comes from published information that has assessed an increased risk for people with selected conditions. I would say Down's syndrome would be a good example of that, where they've actually been able to demonstrate in peer-reviewed literature that people with Down syndrome have been shown to be at increased risk. Another risk, though, is that all of those underlying medical conditions that anyone with a disability might have also puts them at increased risk. So it really focuses on the underlying medical condition. But if an individual has some sort of developmental disability that affects the heart, the lungs, the neurologic system, those would again be included under those with an underlying medical condition. But in addition to that, someone that has a disability that would that could potentially limit their ability to understand prevention measures, limit their ability to adhere to prevention measures, would put them at increased risk for exposure. Or if they had an issue that significantly impaired their mobility and they weren't able to avoid exposure, and that could potentially put them at increased risk. So those would be some examples, but again, the majority of this rests with those underlying medical conditions that other people would share.
Now that we've been vaccinating certain populations for several weeks, have we seen any notable decreases in cases, hospitalizations, and deaths in these populations that are likely vaccine related? And if so, what are some examples, and could you provide any figures for the decreases?
Well, we have seen some decreases in the population as a whole, both in South Carolina and nationally. And we know that the contributors to that have multiple factors. We have to remember that we only started vaccinating people in late December, and that the proportion of the population, since the only products available to date were the 2-dose series, the proportion of the population who have completed both doses and who have made it outside that window where it takes the body's immune response to give them the maximum protection is really a relatively small number of people out of the total population. So the decline in disease rates that we were currently receiving, we're probably just beginning to see the effect of the vaccination, but we don't yet have enough people who have completed the 2-dose series. We want to focus really on the fact that other prevention measures, other community-wide mitigation factors have played a really big role in that. And the other factor is that we had such a large number of people who were infected under that huge surge that those individuals have presumed immunity for about 90 days. So it is those multiple factors that are driving the cases downward. So we don't yet have good numbers to give on what proportion of the population we can attribute to being vaccinated. But as we get more and more information about those who have completed the 2-dose series, and now with the Janssen vaccine, even the 1-dose series that will bring people to full immunity even sooner because they don't have to complete those 2 doses, we'll continue to monitor that information, but don't yet have numbers on that yet.
Dr. Bell, that's a perfect lead into the next question. Can you provide an update on the Janssen or the Johnson & Johnson vaccine? Has DHEC finalized the distribution plan for this new vaccine, and what providers will it be going to?
So DHEC has a rolling out plan for that. We have identified a large number of independent pharmacies who will be receiving those initial doses of the Janssen vaccine that's been made available in the state this week. And then we have a continued plan to roll out that particular product to help individuals who may be lost to follow-up, who may not be able to get that second dose. So the plan in the weeks to come involves reaching providers who are serving those who have unstable housing, individuals who are experiencing homelessness or who are in shelters who would be very difficult to get follow-up to get a second dose for them, and others who may have challenges in rural areas. So we're again making sure that we have access to those independent pharmacies in rural areas. And then as we continue to roll this out and continue to get more of those Janssen vaccine doses, we will also be providing it to physicians' offices who have had challenges meeting the storage and handling requirements, but particularly for that Pfizer product with those ultra cold storage and handling requirements. And so we do have a plan, and we look forward to seeing how that vaccine supply will increase. As we roll out that plan, we'll continue to use that in a targeted way, but at the same time making it available as soon as we can to as many providers as possible.
Thank you, Dr. Bell. Nick, I've got another question for you. Last week, DHEC indicated that FEMA has offered to facilitate mass vaccination sites, but South Carolina is holding off because those sites would use our existing allocations. Excuse me. Would using FEMA help vaccinate people more quickly and alleviate pressure on providers?
Right now, the biggest pressure on all of us, providers included, is supply. And it continues to be that way as it has been. So I'm not aware of any large number of FEMA staff or staff that FEMA have offered to send in our direction, but I can definitely say we're not holding off. You know, we want to hear from them if they have sites who are coming to us with both additional vaccine and the staff to run it. We don't want to be taking state vaccine and moving people over to try to run a separate clinic. If there's basically a turnkey operation that they can send us, that would be great. But I'm not aware of any large bolus of staff that they've offered to send our way.
And Nick, what are our current weekly vaccine allocation amounts for Pfizer, Moderna, and then for Janssen?
Sure. For the current week, it's 57,330 Pfizer. These are first doses, right? So 57,330 Pfizer. 40 for Moderna is 48,800. And for the current week of distribution, there was no Janssen. So for this coming week, for ordering now, effectively, is the process that we're going through. For this coming week, it's Pfizer of 62,010, and Moderna is the same at 48,800, and then the Janssen is 41,400.
Thank you, Nick.
Sure.
At this time, we're going to open it up for live questions and answers. So if you can please raise your hand. Chris Joseph, you've got a question?
Yeah, thanks. Dr. Bell, CMS policy has been cited by both the governor and DHEC as to maybe the prohibiting factor for nursing homes to be opened up to full visitation, pre-COVID, I guess, status, I suppose. Federal guidelines aside, what is your opinion on how safe it is to open nursing homes? And if so, I guess, how is that conversation going within DHEC and perhaps with the governor's office?
Well, the nursing homes are under very stringent requirements to follow CMS requirements as well as DHEC requirements to prevent the spread of COVID in those congregate facilities. And we've actually seen a very significant decline in cases and outbreaks in nursing home facilities. So we know that these requirements for infection prevention measures are what are protecting people. We, as you said, have had ongoing discussions about the visitation policies. They must follow the CMS requirements for allowing visitation if they're in a community where the surrounding disease positivity rate. The percent positivity rate is less than 10%. That's one criteria. But they also must not allow visitation if they've had a case in a resident or a staff member in the last 14 days, or if they're not able to maintain the recommended infection prevention measures for some reason. So we are continuing to monitor which facilities are actually allowing that visitation following that criteria. This is an ongoing conversation with the governor's office in monitoring the compliance with those recommendations that nursing homes have in place, and that those facilities that should be allowing visitation are doing so. And if they're not allowing visitation, and it seems like they should be, we're following up with those facilities to see if there are some criteria that we're not aware of that is preventing them from allowing visitation that is as safe as possible, protecting the residents, that those who enter those facilities don't run the risk of introducing the disease, especially when we're seeing those great declines, and that we continue to protect those individuals who are at really high risk of being exposed and of suffering complications should they be exposed, because they are generally a very fragile population.
So, Dr. Bell, I just want to be clear here. Is it your view that it is not safe at this point to reopen nursing homes to more visitors and greater visitation?
Well, this is in a facility by facility criteria. So if they have the infection prevention measures in place, then facilities are able to demonstrate that that specific facility is able to host visitors. So you can't make a statement as, is it safe on the whole, because it depends on those factors that I mentioned, the percent positivity in the surrounding community and the infection control measures that are in place within the specific facilities.
Thank you, Dr. Bell. Morgan, you've got a question?
Hi, yes, thank you. I was wondering if with teachers kind of getting vaccinated, how many teachers, I know it's going to be different for each district, but kind of what is the percentage for teachers and school staff who need to be vaccinated in order to essentially make a safe school, kind of similar to a population size needing to be vaccinated to be considered safe? What does that look like for schools?
Well, I can try and take that question, because what we've said all along is what we're looking at for safe schools are the guidelines that we have provided for schools from the very beginning, that they require the use of masks, that they are set up so that they can maintain the physical distancing, and that they are cohorting students as much as possible. It is all of those factors that have actually contributed to the evidence that we have that says that schools are a relatively safe setting. Limited information about ongoing transmission in schools. And so we have never really been looking at a vaccination rate for teachers to say that the schools are safe. We have been relying on the prevention measures and have really been focusing on this message throughout, that the way we make our schools safe is to make those surrounding communities safe, which is where we have seen the majority of cases acquired that are associated with people attending school, is that those cases have been acquired largely in the surrounding communities.
Gavin, you've got a question?
Yes, Dr. Bell, I was just want to get your thoughts on how phase 1A has gone so far now that we're nearing the end and moving on to phase 1B. Do you think enough people have been vaccinated? Did this meet any guidelines and maybe goals that DHEC had when it came to how many people have been vaccinated in phase 1A at this point? And if not, what do you think is a reason behind that?
Well, we, as Nick has said, we were beginning to see a slowing in the request for appointments for those in phase 1A. So while we originally said we wanted to achieve a certain percentage of the population who is eligible in phase 1A, we know that when we start seeing the slowing of the request for appointments, we may have reached a point where vaccine acceptance is another factor. We just want to make sure that vaccine access is not a factor, so that we will continue to encourage anyone who is not vaccinated in phase 1A to go ahead and make an appointment as we've moved into phase 1B. Another factor that we're really paying close attention to is the concern about any health disparities or any inequities in access to vaccine. This has been brought to our attention in phase 1A that it didn't look like a large proportion of those who are in communities of color had been vaccinated in phase 1A. And there are some explanations for that. It's because many were not eligible in phase 1A as being healthcare workers, not a high proportion of minorities who work in that sector or who are in nursing homes that we were targeting. But as we move into phase 1B now, we will continue to carefully monitor access and the fair and equitable access to vaccines. And if we continue to see health disparities or inequities as we move into 1B, we'll continue to do what we have been doing, which is to make plans for access in rural areas, those who have limited access, and to monitor our demographic data and see how we're meeting those expectations.
Nick, you've got a question?
Good afternoon, Dr. Bell. One little question and the one main question. The little question just was from a hospital that was passed on to me. If there's guidance, if college students that are living in dorms are eligible for phase 1B. And the question that I have is, does DHEC have any further information about 28,000 people or so in South Carolina that are overdue for their second of the 2 vaccine doses?
I'll take the first question about the college students in dormitories. That's actually not a setting that we consider as a congregate living setting. It's also made largely of young, healthy people. So college students would only fall into the phase 1B criteria if they're in that 16 to 50-year-old age group and having underlying conditions. But as a whole, we're not considering them at risk because of that dormitory living. And then I actually didn't hear the entire part of your second question.
The second one was the data that DHEC has put out suggests about 28,000 people or more in the state are overdue for their second dose of the 2 doses of the vaccine. Didn't know if there was any further information about why so many people have not gotten it on time, or if the agency is doing anything to reach out to these individuals or providers to get that number lower.
Well, we're asking them, as we said earlier, for individuals to work with the providers where they receive the first dose as much as possible to get that second dose, or to continue to search for, another provider to provide that second dose. We know, of course, the problems that the winter storms caused with getting people caught up, and we know that providers are working really hard to get that group of people caught up while simultaneously making appointments available for new people who have yet to receive their first doses. And I'm not sure if Nick may have something to add to that about the catch up for those who are challenged to get an appointment for their second dose.
Sure, I'll just add that, I know that we've heard there were some instances in that great desire to vaccinate, to get additional individuals vaccinated, where from time to time some second doses were used to vaccinate those for first dose appointments. While we've put out additional guidance to make that really clear that is not a smart practice, and we ask that people don't do that. What that will mean is that in some instances, facilities and providers will have to prioritize those second dose clinics by sometimes using a first dose to be able to temporarily take care of those second dose folks. But it certainly is also understandable that there is going to be some tendency for some individuals to have received their first dose, and maybe it's a little less urgent in their minds to receive that second dose. But we really need them to seek out that second dose, keep that second dose appointment, and asking providers if they have to cancel some second dose appointments for various reasons, that they prioritize getting those folks back in as soon as they are able or have the vaccine to be able to do that.
Mike, you've got a question?
Last week, Dr. Simmer told legislators that 400 seniors would be hospitalized and 3,500 new cases among seniors if a smaller 570,000 person 1B group were added. At the time he said that, I believe DHEC was already expecting the Janssen vaccine to come online. So given that, what has changed and what is the number of additional seniors that are expected to be hospitalized and new cases under this larger group?
Right. So let me be really clear, and this is an important distinction, is that those estimates he gave were when we were going to have to stop vaccinating others if we were to do the teachers instead. So when you stop vaccinating those in high risk to do a group of people like teachers, those estimates were given to make it clear that doing so would put others at risk. Using the 1A and now 1B criteria, we continue to use risk as our primary criterion. And so so we wouldn't be expecting to have delayed vaccinations, which could result in hospitalizations and deaths.
Thank you, Nick. We're out of time. I would like to remind members of the media that we plan to hold another 45-minute briefing this Friday. Send any follow-up questions that you have to our COVID Joint Information Center, and we'll get them answered for you. Thank you all for your time and dedication to share the latest updates about COVID-19 and our state's vaccine rollout with South Carolinians. This concludes today's briefing. Thank you.